putting up with our hygiene for the better part of this past hour. Now listen, JD, you know I am married to a licensed chiropractor.
Dr. Lander.
I have a little bit of an advantage here. Have you ever been to a chiropractor?
I have not been to a chiropractor, but my mom goes regularly, loves it, says it's life-changing stuff for her. So I'm here for it.
I know, and a lot of people twist, they turn their bodies and they think they're cracking their back, their knuckles, their neck. But what actually is happening to our bones? And what are the long and short-term ramifications of it all?
Good question. We're going to get the answer to it. Chiropractor Dr. Anna D. is here to separate fact from fiction when it comes to our spinal health. Dr. Anna, welcome.
Hi, thanks for having me.
It's great to see you. I'm suddenly sitting up very straight.
I know.
So am I. So am I.
Me too. And when you said, have you ever been to a chiropractor? I was like, well, now I feel like I really,
I
feel like I really need to.
I'm watching you guys.
That's right.
There are a lot of misconceptions around what exactly it is a chiropractor does. Can you clear that up? Tell us.
So a lot of people don't know a lot about chiropractic. Maybe all they know is from what they see on social media, where the chiropractor is doing one thing or they're treating only one area, when in reality, chiropractors can treat more than just the spine. They could treat the headaches, they could treat dizziness, your arms, your legs, so many different areas, and they could do more than just the cracking adjustments. They could actually do stretching, massaging, exercise guidance. Chiropractors out there these days are really doing the most.
They really have, and I say this because I mentioned at the top of the show, I'm married to one, and he says if we're doing our job right as chiropractors, you don't know if we're orthopedists, neuroscientists, physical therapists, chiropractors, because it's a holistic approach.
Yes, yes. And plus, another thing is that if you go to a chiropractor and they find that they need the assistance of one of those specialties, they'll be able to refer you out to one of them.
That's right.
Let's dispel one of the big myths, which is I need to crack my back. The idea of cracking things. You're not actually cracking bones, right? When we do this, what's really happening when you adjust me?
So when you hear that kind of cracking or popping sound, some people get a little alarmed and they think it's, you know, bones that are clanging against each other, or they're like maybe even breaking, when in reality, the sound of those gentle pops are actually gas bubbles that are between the bones, within the joint fluid, that kind of dislodges when you do a gentle movement, and then it makes this pop sound, kind of like opening up a soda can and you hear the pop sound. So it's actually very gentle, very harmless, and in fact, sometimes even us getting off this chair will actually
every
cause
day it's like
pop sounds. Yeah,
exactly.
So I tell people, don't be afraid to move. If you do hear those pop sounds, they're totally fine. In fact, people ask, how about if I'm like cracking my knuckles all the time, right? Do you crack your knuckles?
I do all the time. It's like literally a little nervous tick. Yeah, I do it.
What about this idea? Because I used to crack my knuckles more when I was
And
younger.
they said it would give you arthritis. Does it?
Oh, well, the thing is, there has been a doctor that actually did a controlled experiment with himself. He basically, for 60 years, only cracked his left hand knuckles and didn't crack the right hand. And you know what? After 60 years, they took an x-ray and then he found that there was no difference in osteoarthritis on both hands.
Okay,
so,
sample size of one, but I like the
Thank you.
data.
I like it.
I like
I'll
the
take
data.
it.
I do.
I'll take it. Yeah. So, do folks in their lifetime need to have an adjustment, or is it something you do something and that necessitates you?
So it could be that somebody does something, flares up and comes, or some people might come for more of a wellness thing. Some chiropractors like to compare it to kind of like going to the dentist and taking care of your dental hygiene. Well, if you go to a chiropractor, they're taking kind of care of your spinal hygiene. So essentially it's like, hey, if you are doing your exercises, if you're watching your posture, if you are getting, you know, massages and stretching, maybe you don't need to go to a chiropractor as often, but hey, there are some people who will benefit from it depending on their lifestyle.
That's right.
But you're also saying that going to a chiropractor is part of more of a holistic plan of you still want to do your exercises, you still want to stretch, you still want to be doing all those things?
Oh yeah, of course. Some people think if I am in pain, I should probably not exercise. They think if I have hard, stiff muscles, I shouldn't make it even more stiffer by exercising. I should just rest and not do anything. When in reality, it's, hey, think of it this way. If I feel pain lifting a 15-pound dumbbell, that doesn't mean never lift a 15-pound dumbbell ever again. It means no, do 5-pound dumbbells, 10-pound dumbbells, 15-pound dumbbells. Then you do 20-pound dumbbells, then all of a sudden the 15 doesn't hurt anymore. Right. So this is trying to say that sometimes people are in pain because they don't have the strength or the endurance to do their movements. So it's important to also make sure you are doing your therapeutic exercises at home and regularly.
Oh my gosh.
Interesting.
This is amazing, right?
And if I go to the chiropractor, do I have to? I've heard people think this. If I go to the chiropractor, I get an adjustment. Well, now I have to go forever.
Oh, right.
Like that it's some sort of, I don't know, not an addiction, but sort of like a. But
I'm
like if you
addicted to
don't
my
go back,
chiropractor.
your back will get out of alignment.
Right.
You'll be worse off.
Well, if you are going to a good chiropractor, they will give you advice on what you could do at home to prevent the pain from coming back. They'll tell you what you could do at home in order to make sure that you're doing your exercises so you don't have to come in as often. So at least at my office, we do have a lot of people who come in as needed. And then we actually have a lot of people who just love the feeling and they come by weekly. So shout out to everybody who's come that often. We have a lot of loyal patients. And they find that, you know, it's just something that they can come regularly for, and that's up to them. And then, as mentioned, if you are coming in only for flare-ups, that's fine with us as well.
Yeah. Maintenance. It's all
Yeah.
maintenance. Your patients must like you, because my husband says the same thing. He's like, if I'm doing my job right, you should never have to come back to see me. And if you're coming back to see me, you must like me.
Right.
So that your patients must like you.
They do. They do.
Indeed.
Fantastic. Well, thank you so much.
Thank you.
You have dispelled all sorts of myths for us. Even the control room was weighing in, saying we've
Yeah, they're like,
learned a lot.
oh, I'm learning something. You can get more information, by the way, from Dr. Anna D by going to unitycw.com.
I